All right, let's talk about rheumatoid arthritis. It's a condition that affects millions of people. And believe me, it is so much more than just achy joints. We're going to dive into what that really means.
You know that feeling, right? You wake up and you're just stiff, a little creaky. You stretch it out, get moving, and, it usually just fades away. Super common, we've all been there.
But what if that stiffness doesn't just fade away? What if it's actually a sign that your body's own defense system, your immune system, has started to attack you? Yeah, that's the wild reality of an autoimmune condition, and it is right at the very heart of what we're talking about today.
Okay, so first up, what is rheumatoid arthritis? What's actually happening here? A good way to think about it is your immune system gets a little confused. This isn't your typical wear and tear arthritis. Nope, this is a case of mistaken identity happening right inside your body.
So picture your immune system like it's the security team for your body, right? Its whole job is to fight off bad guys, viruses, bacteria, you name it. But with rheumatoid arthritis, or RA, that security team gets its signals totally crossed. It looks at the healthy, soft lining of your joints, that's called the synovium, and mistakes it for an enemy. And then it launches an all-out attack. The result is this constant inflammation, which is what causes all that pain and swelling.
All right, so let's talk about unraveling the symptoms. How does this internal battle actually feel? Well, you've got to listen to what your body is telling you, because recognizing those signs, that is the crucial first step.
Okay, so the classic signs you hear about are all focused on the joints. We're talking pain, obvious swelling, and sometimes the joints even feel hot to the touch. But here's the real kicker, the thing that really sets RA apart. That morning stiffness we mentioned, it doesn't just go away in a few minutes. We're talking about a deep stiffness that can hang around for well over half an hour, sometimes even longer.
And here's something that might surprise you. RA isn't just about your joints, and this is a really, really important point. It's what we call a systemic disease. That means the inflammation can pop up literally all over your body. It can affect your eyes, making them dry or painful. It can cause these little lumps under the skin called rheumatoid nodules, and it can even impact major organs, like your lungs.
So you can see how with all these different symptoms, getting a diagnosis isn't always super straightforward. It's not like there's one single test that just says, yep, it's RA. It's really more like a doctor has to be a detective, putting all the pieces of the puzzle together to see the whole picture.
And that diagnostic journey, it usually happens in about 3 main steps. Step 1 is just a conversation. Your doctor's going to ask a ton of questions. What are your symptoms? When did they start? What do they feel like? Then comes step 2, the physical exam. They'll actually check for things like swollen joints or those nodules we talked about. And finally, step 3 is the investigation, where tests come into play to really confirm what's going on.
And a huge part of that investigation is looking for clues in your blood. First, they check for what are called inflammatory markers. Just think of those as a general alarm bell going off in your body, saying, hey, there's inflammation here. Then they get more specific. They look for certain antibodies. One is called rheumatoid factor, or RF. But the really big clue, a much more specific one, is an antibody called anti-CCP. If that one shows up, it's a very, very strong indicator that RA is the culprit. Next, they'll want to literally see what's happening inside the joints, and that's where imaging comes in. Now, X-rays are useful, but they tend to show damage that's already been done. What's really cool is that newer tools like ultrasound and MRI are amazing for early detection. They can spot the very first signs of inflammation. We're talking soft tissue swelling, way before any permanent damage happens.
Okay, so the diagnosis is in, now what? The good news is, the way we manage RA today is completely different than it used to be. It's a modern, multifaceted approach. There's no single magic bullet. Instead, it's about attacking the problem from all sides.
And that management really stands on 2 big pillars. On one side, you've got all the lifestyle and support stuff. Think physiotherapy to keep you moving, occupational therapy to help with daily tasks, even things like support groups, which are so important. Then, on the other side, you have the medical treatments, and this can be anything from basic pain relief all the way up to incredibly powerful drugs that are designed to stop this disease in its tracks. Now, inside that medical pillar, there's this one group of drugs that absolutely changed the game for people with RA. They're called DMARDs, which stands for disease-modifying anti-rheumatic drugs. So, the big question is, what are they actually modifying? Let's take methotrexate as an example. It's one of the most common DMARDs out there. The first thing you need to know is, it is not a painkiller. It's not for instant relief.
Its job is way bigger than that. It actually calms down that overactive immune system to stop it from causing long-term damage. Now, it does work slowly, so you have to be patient. That's why doctors will often start you on a short course of steroids at the same time, just to get that immediate inflammation under control while the methotrexate gets up to speed.
So when you put it all together, the early diagnosis, this multifaceted approach, these really powerful medications, it all points to a totally new reality for living with RA. What we're aiming for with treatment today, well, it's so much more ambitious than it used to be.
And this right here is the fundamental shift. Modern RA care is all about being proactive. The goal isn't just to react to pain when it happens. No way. It's about getting out ahead of the disease. It's about reducing that underlying inflammation, preventing those painful flares, and, this is the big one, stopping that long-term joint damage before it can even start.
So we have covered a lot of ground here, right? From those first little symptoms all the way to the pretty complex world of treatment. And look, there's no doubt about it, rheumatoid arthritis is a complex and serious condition. But knowledge really is power. Just understanding what's going on inside your own body, that is the absolute first step to taking control. So, that leaves one final question. What will your first step be?